Hey guys, welcome to the first ever Liberty Speaks podcast. I'm Dr. Irene Mavrakakis, and I have my co-host here with us, Brittany Kosin. Hey Brittany, how are you?
Good, how are you, Irene?
I'm good. This is going to be an epic experience. We've been planning this for 3 years to the extent by which we all got busy with many things. Brittany and I are definitely into the medical freedom movement. And we want to say a couple of things. First of all, this is not medical advice. We do not have a doctor-patient relationship with you. And these are our own personal opinions and do not represent the opinions of our employers. Okay, done with the boring stuff. So we have to talk about it, okay, Brittany, at least a little bit in the first episode. I just want to talk about how the heck did it actually happen in the United States and the world that federal government, state government, businesses, both in the United States and the world, decided that for a respiratory virus that we were going to lock down the world, do a whole bunch of experimental stuff, and shred our Constitution. And the attempt by the government to do that was bad enough. But I felt like I was literally in a dystopian universe witnessing Americans and people around the world literally forget who they were as free people and forget the Constitution. So I think we have to talk about why it happened, how the heck it happened, and how it can never happen again, and how it should have never happened. What do you think, Brittany?
I was shocked that as many people went along with it for as long as they did. In the beginning, I was part of the 2 weeks because we didn't know what this was, and being like, sure, let's see what it does, see what everything happens. But 2 weeks became 3 became 4 weeks became 2 months, 3 months, a year. So it's like, at what point did we just roll over and accept defeat? Like, we're coming up in the next 2 years for our country at our 250th anniversary of signing of the Declaration of Independence and basically telling England to pound sand. And we're now here letting the government that did that, again, very modified, did that, just us around and tell us what to do, and we're not fighting back anymore. And we need to start doing that. And that's why I got really involved in this medical freedom stuff, because we need to get our minds back to our own perspectives and not let people control us.
Right, exactly. And it's interesting. And as you know, of course, I've been down some medical and constitutional deep dives trying to understand how exactly this happened. And one question I finally figured out was, how the heck did government have it in its conceptual wheelhouse that a vaccine or biologic, could be forced or coerced? And it all starts with this case, Jacobson versus Massachusetts in 1905. And I know you are sick of this because I'm obsessed with this, but it's so absurd. So they had smallpox and the vaccine, and this town, it wasn't the whole state of Massachusetts, had a public health mandate requiring vaccination and some other components to that. And he didn't want to take the vaccine. And so he refused, and it went to court. And he lost. Okay, this is 1905. And the consequence was that he had to pay a $5 fine, which is $200. But that has been used for the basis of government coercion and forcing of experimental medical, medications, PCR testing, vaccines, biologics, and the like. And since then, we've had many cases that have essentially ruled that everybody has a right to refuse medical care. And there's some recent cases that are super exciting, that are starting to put a hole in this Jacobson precedent, that LA Unified School District case, where the Ninth Circuit ruled in favor of teachers who sued the school district for unconstitutional mandates. And Judge Collins discussed that really, because it violates constitutional rights, employers do not have a right to have a mandate that violates your civil liberties, that there's a higher threshold related to civil liberties. And the judge was just brilliant. And I think that that's a big dent in Jacobson. And I think we have to keep putting forth these court cases and continue to win.
Yeah, we have to really get and really start standing up and fighting back on different things, because we can't keep going by and not having, like, in like, especially in my case with being in an emergency department, we can't go by and have such low staffing numbers that we're having to shut down like almost half of our floors up on the upper floors because we can't get staff, because no one wants to get the vaccine, or they don't want to work in the environment that's been created post-COVID. Like, it's just getting ridiculous.
Right, exactly. There's a nursing shortage. And what boggles my mind is that there's no thought process to the fact that you have nurses refusing to get this experimental vaccine and biologic. And a lot of them submitted medical and religious exemptions. And a lot of these people had their religious and medical exemptions declined, which is another court case that I'm super excited about that just came through last week. It wasn't a nurse, but it was someone who worked for Blue Cross Blue Shield of Tennessee. And she submitted a religious exemption and it was denied. And she's like a biostatistician or something. I'm not sure, something in that kind of arena. And they declined it and she got fired. And so she sued, and it was a jury trial, and she won over $650,000, even punitive, because they said that she had a sincerely held religious belief, and also that they essentially didn't make any attempt to accommodate. And that's the whole point, is that, you know, if you submit a religious exemption, it's not for some layperson to decide what your sincerely held religious belief is. It's whether or not they could reasonably accommodate. And that ties into the fact that, you know, COVID vaccine and biologics don't prevent transmission anyway. But the interesting part of this, and I would be remiss in not saying this, we should not be having to submit religious and medical exemptions for medical procedures in the United States of America, because we have the right to bodily autonomy and informed consent. And informed consent necessitates your ability to decline without interfering with life, liberty, and the pursuit of happiness. And so if you can't freely decline, you can't have informed consent, and that's standard of care. So none of this should be occurring, but it is, right?
Yeah. Now, also, you go in with that too. We have in the First Amendment is freedom of religion. Like, we can practice whatever religion we want. So by saying, well, no, we're not going to accept your religious exemption, because you're basically saying then that their religion isn't accepted, and you're not letting them have their First Amendment right just with that. So it's multifaceted when you start really breaking it apart.
Right, exactly. And then if you talk about the 10th and 14th Amendment, you know, the fact that the federal government has no role in healthcare, that it goes to the states of the people, and that the 14th Amendment discusses that, you know, there should be no law that violates life, liberty, property, and the pursuit of happiness. And literally, government became destroyer of our civil liberties as opposed to the enforcer in some dystopian upside down land. But I still haven't gotten over how many people told the line.
Yeah, I know, I in the beginning, like, because I didn't have the freedom to be able to be like, oh yeah, I don't need this job. Like, I was the sole provider for the household. Like, I kind of had no choice to go in. but I really didn't see much difference in this vaccine versus when we would do flu vaccines every year. We give religious and allergy exemptions for people for the flu vaccine, and flu season, they just have to wear a mask when they're at work. So, like, what was the difference? Like, we already were being forced to wear a mask. Like, at that point, we were even, like, being forced to reuse N95s. Like, what's the difference of having it that they're already wearing a mask, so what's the difference if they get vaccinated or not?
Right. And it's super interesting because it was an experimental injection because it had emergency use authorization. And the other part that people need to understand is that, you know, the yearly flu shot was brought to us by a previous pandemic, and that is tied to something called quality measurement payments, where doctors and facilities and hospitals have to have a certain percentages of vaccinated staff members to meet certain quality measurement payments, and they get bonus payments from insurance companies. This is all true. And so the healthcare facilities and entities like surgical centers and hospitals had the Center for Medicaid Services mandate that they had to have a certain amount of vaccinated healthcare providers. It's a biologic, so it's a biological injection, just for clarity, and or a certain low amount of religious and medical exemptions. I don't know how many, or they wouldn't get their quality measurement bonus payments, and they would lose CMS participation. And a lot of hospitals are 50% Medicare and Medicaid. And so the hospitals, I'm not giving them an out, but the hospitals toed the line because they would have gone bankrupt in the middle of a pandemic, right? So this is such a quintessential example of governmental interference in medicine, and how we need to really reset everything and have increased freedom, competition in the government out of healthcare, and separation of science and state.
Yeah, even going into that, like, the government started affecting small, or not small, but like businesses, and it's just like that trickle down effect. It affected the communities and everything like that. Like, they didn't have much of a choice. They're like, well, our hands are tied. We can't have all of you refusing because we don't get money, and if we don't get money, we can't pay you. So, well, if you're going to cost us money, we're going to fire you. And it's kind of not fair, but it made sense, but it shouldn't come to that.
Right. No, exactly. And the business part, I've changed my position on this recently after the LA school district ruling, and I've done some additional reading on libertarian principles, and I have pivoted on this. I wasn't really that strong on the private property. Business owners have a right to do whatever they want. But after reading through the LA Unified School District case, and the idea that if a business has a rule that infringes upon civil liberties, it's unconstitutional. And the concept that the government, we do accept, unless you're an anarchist, the government has a certain role in protecting civil liberties and the rule of law, you know, and certain things that we agree as a common community that we want the government to be involved with, very small government. So I don't think you can say like a business could have a vaccine or biologic mandate and be principled in your libertarian ideas, because it's not like, hey, you got to wear shoes to work. And it's about asking you to get an injection into your body that's experimental. And that goes back to that LA school district case. And the other part of it, which is also interesting to me, it's not a correct application of HIPAA, Brittany, right? Because HIPAA doesn't apply here. But a human being should assume that they don't even have to freaking disclose what the hell their personal health information is to their freaking employer in the first and second place. You know, so you can't even, when you interview people for jobs, you can't even ask if they're pregnant. So why the hell are we asking people's vaccine status? I mean, it's a complete invasion of a zone of privacy concept that has been codified in multiple case law. So I really I wasn't really in agreement with the business being allowed to do whatever it wants. I wasn't sure how I felt, but the last few months I've been much more strong in my position that it's not as a matter of private property. You have a right to have such things.
Well, you get into that, it gets into a real gray, sticky area because it's like, yeah, the business can do what they want because it's their business, but by telling them they can't do that, to give other people their freedoms, like it's like you can't have your cake and eat it too in that case, because the people that want to frequent those businesses and be employed by those businesses don't want to be able to have to disclose that, but the businesses shouldn't be able to ask it, but they can. It just gets real hairy real quick.
Yeah. You know, it's funny that you said cake and eat it too, because then it goes down to this quintessential libertarian about case about the baker and the cake and whether or not you have to bake a cake for anybody that when you were saying cake and eat it too, I was thinking about that court case. And I was like, I'm not ready to have that conversation with you, Brittany. We're gonna have to stay in medical freedom. Oh wait, there's another case that just was ruled on. This is interesting. So a lot of doctors trying to speak out. And also, you know, initially it was a demonization of hydroxychloroquine and zinc and ivermectin, which has been shown to be safe and effective. And they demonized the concept of off-label, but, you know, off-label stuff like aspirin is accepted. And, you know, it's interesting because you can't get emergency use authorization for a vaccine or biologic if you have a medication to treat. But, you know, doctors have to have, you know, medical associations and licensure. And a lot of doctors had problems with their medical boards, and they were using their own judgment and assessment of the situation and prescribing medications and recommending nutraceuticals. And so there was just a recent case, and we have the headline up here, and this is another one that I'm super glad about. It's U.S. Court of Appeals for the Fifth Circuit has reversed a dismissal of a case from physicians who were seeking to sue various credentialing boards. So we have, for example, we have a state license, but we also have like board certification from, you know, if you're internal medicine or a family practice.
Your specialties.
And it says that they're sue various credentialing boards who suppressed them for going against the official government storyline about COVID-19. And so this is good for medical freedom. The U.S. Court of Appeals has reversed a dismissal, so the case will go on. So this is really good for some brave physicians who spoke what they believed through their true ethics of the Hippocratic Oath, that it is their job to assess risks and benefits and make recommendations to their patients based on their medical expertise and not following central planning edicts.
Oh yeah, you have it different. You have these different doctors that are in these specialties that have been doing that for years and advancing their knowledge and continuing their education on stuff. And they know their clients in that area. They know their patients. They know their population that they're dealing with. So they know what people are more willing to accept and do versus someone who's up in their ivory tower. Like, it's definitely, this is nice to see.
You with the brown paper bags that you guys had to put your N95s in to save them for the next day, or however you
3 days
did that. And so what are your top 3? Oh my God, why are we doing this? We've all forgot medicine and science, COVID like dystopian experiences.
Mine honestly is we're coming into that time of year and I guess we'll go down this rabbit hole a little bit. It's Joint Commission time, at least in my area. So we're going down that route. We're like, oh, look, the people that got to hide away for 3-4 years and are now coming back to tell us what to do. It's like, no, you were the ones. Where were you when we were wearing trash bags as gowns and reusing masks for 3 days, or having to spend our own money, hundreds of dollars, to get Envo masks and the accessories for them to be able to properly wear them in patient rooms? And like, oh yeah, so a N95 mask and safety goggles are going to protect us from an airborne respiratory disease. Like, so we're going to take this mask with our gloves and take it off and go and put it in a paper bag so that the outside of the mask is now touching the bag and percolating in there, so it comes on the inside of the mask. But they also had the sanitation procedure that they did that I have no clue what it was. But like, how do you know that that sanitation procedure didn't affect the integrity of the mask when you got it back? Like, is it still as effective as if I just took it out of the box? Like, where's the testing on this? Who is this they that, or they're saying, oh yeah, they say it's safe. Well, who's they? Where are they coming from to say that this is safe? So it's a lot of this infamous they that pissed me off the whole time and still does. Like, but it's just, now it's like, okay, so what happened to, you're supposed to be wearing a mask and eye protection and all of this when you go into a suspected COVID patient room? Because those rules never technically went away, but now it's like, yeah, it's okay that your patient, they don't even tell you if the patient like tests positive. Like, we do the rapids and stuff, but how effective are they? But you used to get, I would get emails, 5, 6, 7, 8 emails on my days off. This patient, MRN number, blah, 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 tested positive for COVID. This patient tested positive for COVID. Like, okay, cool. I kind of figured. Like, but what's going to be different and stuff now? It's like, okay, cool. You got COVID. Okay, come back in 2 days. Like, they've completely done a 180 on all the rules and restrictions on this. It's like, so why weren't we treating it like this 4 years ago? Like, it's this back and forth that really just gets irritating, and like, just completely changing their perspective on things and be like, oh no, yeah, we're not backpedaling at all. Like, this is fine. You see nothing. Like the whole Wizard of Oz, you see nothing. This is all an illusion.
Right. Right. And there's so much there because, first of all, the asymptomatic use of PCR testing is failed, right? So they were testing people who were getting car accidents too, right? But if you have someone who's symptomatic using universal precautions, like all of that kind of was problematic. But let's talk about our country. The idea that our country, our infrastructure, our production abilities are so failed that there was no way for private businesses to help us with personal PPE, right? Personal protective equipment for healthcare providers at a time where in the beginning, you guys didn't know if it was like Ebola, right? If we're being honest, right? You didn't really know. And, I'm a outpatient-based specialist, so I wasn't, in the ER with you, Brittany. But, when it all first came out, the idea that our country is not able to provide, they did studies like the stuff that grows out of masks when you reuse them. I mean, it's literally like you're taping a tissue that you sneeze into your face, sticking in a paper bag and taking the tissue out the next day and pasting it to your face. I mean, we lost all scientific logic. That's just one small example, of the many infractions of basic clinical acumen and skills, that it just, the reason why you and I do this is both for the concept of the science was wrong, that there wasn't separation of science and state, but also, that our Constitution was shredded, both, and that the people allowed it, right? Because it all could have stopped.
Yeah, everyone just kind of was like, sure, let me just roll over and blindly accept this. I really was. Now, with the ER and stuff like that, and I am in a, I'll say medium-sized metropolis area. Like, I do have a pretty decent sized city population nearby, so they're like used to living in close quarters because I have a lot of apartments, and I do have a decent sized homeless population that does come through my ER. Like, a lot of these people were already like, this is nothing. Like, you go and get the flu or a stomach bug and that passes through the whole building. Like, this is nothing. Like, and I did have a decent amount of people that were like, kind of did push back, but I was shocked of there weren't more after a while. Like, yeah, I definitely, I lucked out in the beginning that I was able to go on I ended up going on, I was on maternity leave from the end of 2019 through into the beginning of 2020. And then I ended up going on another leave of absence a couple months later for my husband. So I kind of lucked out in the beginning of not seeing a ton of it, but I was still a customer and still someone in the general population, seeing a lot of people just blindly accepting this and being like, well, the powers that be say so I must do it. And I didn't see as much of what I wished, a lot of people going, but why? No one was asking why, or what are you going to do about it? Like, what are you going to do if I don't do this? Like, I don't want to shop in your store because I have to wear a mask. What are you going to do about it? You kind of need my money. Like, I'll go to another store that accepts that I don't want to wear a mask. So I started seeing that later, but I was shocked I saw as many just kind of blindly following for as long as I did.
Right, exactly. And when did businesses decide that they were going to be the enforcers of state and federal government? Like, when did that agreement happen? Why did they agree to do that? And I don't understand that. Of course, recently at the Libertarian Convention, Liberty Speaks had the honor of presenting Ian Smith, who kept his gym open, got millions and millions of dollars of fines, and he recently his case was dismissed, and he doesn't have to pay the fines and all that. He stood his ground and got all those fines. But again, if everybody was just like, we're not the enforcer of governments, and we're the free people of these United States of America, and the government is here to protect our civil liberties. And we really need to get rid of this Jacobson precedent that kind of sets the stage for a lot of these mandates. And the only way I see that is through a 28th constitutional amendment for medical freedom. And there's an organization and they have a website. Because although the first, 10th, and 14th Amendment do give us these protections, clearly after COVID mania, we need a little help for that. And I know that's an upward battle, but, and I think all of this is just another example of the problems with our failing constitutional republic. It was problematic scientifically, but I feel like this was just a warning sign, because this fear mongering was such a push for totalitarian grab by the government. That's the 28th Amendment by this other organization. It's on our website, on the Medical Freedom website.
Yeah. The other thing I guess kind of reminds me of is just how blindly people follow things. Just makes me feel like the movie Idiocracy is coming true. Like we're just getting dumber, I guess, and we're just accepting it. Like we're relying on technology at this point to be our thinkers. Like, you have AI and everything now. Like, we're not free thinking anymore. We're not using our brains. So you don't use it, you lose it. Like, and I think that's where we're heading, and I don't like seeing that. I don't want the movie Idiocracy to come true. And we're really on a really solid path towards that.
Yeah, I watched Idiocracy for the first time maybe like a year and a half ago. I don't really watch movies all that much anymore. And it was tough because I thought I was kind of watching almost a documentary. And but what I pose to you is, I believe this to be likely to be true, that we're so physiologically sick that there's a physiological basis for our mental decline. Do you see what I'm saying? That it's all of this external interventions and medications and unhealthy food and experimental procedures, and we're unhealthy biochemically. We're in a state of dis-ease. We're not healthy. And I think that the mental decline is, very physiologically based. And yeah, it was not a good documentary, Idiocracy, but
yeah, if you have one bucket that holds 2 gallons and another bucket that holds 5 gallons, how many buckets do you have?
2?
Thank you.
Lord, I wonder what's got the matter. I'm trying all time.
Okay, we have to do a shout out to TJ, your husband. He's our tech director, and he puts up with us and makes sure we do what we're supposed to do. Hey, Brittany, I'm going to promo. We have a guest on the next podcast, which is July 26th at 9 p.m. It's going to be on a Friday. And it's Allison Lucas, and she's an attorney with one of the most prominent law firms, for medical freedom. And I'm so honored that she is going to come on to the podcast with us. And I'm so impressed with the fight that they do. It's Siri and Glimstad, and they're a national law firm that works tirelessly to obtain justice, secure compensation, and protect individuals whose rights are threatened by corporate misconduct and government overreach. Allison has assisted in over 1,000 clients seeking medical and religious exemptions to vaccine mandates. Her vaccine exemption experience includes assisting children, college students, clinical rotation students, employees, and those seeking to immigrate to the United States. So Allison Lucas is going to be joining us on July 26th, and she is just remarkable. And the other attorneys, especially Aaron Siri, are remarkable. I've been following him for a very long time. His Arizona testimony is epic. He's been testifying in Congress recently. And if you really want to go down a deep dive, this is years ago. It's his deposition of Stanley Plotkin. Just Google Aaron Siri's deposition of Stanley Plotkin, who is the quote unquote godfather of vaccine science per se. And it discloses such details of how we got here, where we have complete product liability protection for vaccines from the 1986 law. and the quadrupling of the vaccine schedule since then, and the PrEP Act that protected pharmaceutical makers also from the COVID vaccine and biologics. And because competition and the fear of being sued drives safety and efficacy, and vaccine and biologic makers haven't been culpable since 1986, it's a big problem with research, safety, and efficacy, and issues with our medical establishment. So we're really honored that she's going to be joining us.
Yeah, it's exciting.
So, Brittany, what do you think we should let our listeners know about what kind of things we'd like to talk about? And we will talk about medical freedom, but we're also going to talk about other libertarian concepts, but we'll bring, other experts in because we tend to lean towards medical freedom mostly.
Honestly, even if people want to submit their experiences or anything that they've dealt with over the last 4 years of how their medical freedom was infringed upon, like, we'll definitely be glad to share and show, like, it's not just one or two people. Like, there's a lot of people that are willing to talk out and really share their stories and stuff. Like, we'd be glad to share some stories and stuff. We can keep it anonymous, or we can share their names. It's up to them. Like, it's big. We want to create a family, create a just a whole community around that. You're not alone, and you have like-minded people.
Yeah, I agree. And we might even, if you want to come on the podcast, if you've had your medical freedom infringed upon, like Brittany said, and I'm sure TJ can figure out how to do an anonymous podcast. If you want to come on and tell your story anonymously, you can contact us through the medical freedom website that we work on. I am at Irene Mavrakakis on Twitter, and Liberty Speaks is at National Speaks. And Brittany, what's your Twitter handle?
I haven't figured out what it is yet. We are just getting all started with everything. But yeah, definitely I would reach out through the Medical Freedom Caucus website. I think that's the easiest way to get a hold of me.
Sounds good, Brittany. Well, we're super excited that everybody joined us. Brittany, you're an awesome co-host, and I'm so glad to be doing this with you. Just remember that we always have a right to make decisions in our own life.
Yep.
Talk to you soon, guys.
Mm-hmm.